Hello everyone, how are you? Welcome to another question and answer session. This is physiology question and very important question, which is the ABG. So first of all, let's see the question. Which of the blood gas result listed below is most likely to fit with a patient who has acute respiratory acidosis? So we have to find out a equation which will be compatible with acute respiratory acidosis. So first of all, we have to find out the acidosis, then respiratory part. So normally, the normal pH of the body is 7.35 to 7.45. So when less than 7.35, then it is the acidosis, and when more than 7.45, it is the alkalosis. We have to find out the acidosis. So here we can see the less than 7.35. Here the options. First of all, 7.19, then we can see the 7.14, then we can see the pH 7.32. So the acidosis part in these three options. So our answer is located within these three equation. So let's see a equation which will finalize this equation. So here we can see, in case of all kind of ABG report, this equation is final, which is pH is related to the bicarbonate and partial pressure of carbon dioxide. So the bicarbonate level, here we can see it is directly proportional to pH, and partial pressure of carbon dioxide, it is inversely proportional to the pH. So in case of respiratory acidosis, that means when the pH is reduced. Here another important point, that in case of a respiratory part, the partial pressure of carbon dioxide is directly related. That means in any cause which is responsible for changes pH due to respiratory cause, there the partial pressure of carbon dioxide is the first priority and it is responsible. Then here you can see the partial, then bicarbonate level. This bicarbonate ion level, it is directly responsible for the metabolic cause. So these two things is very important and very clear, and we have to remember very carefully that partial pressure of carbon dioxide, it is related to a respiratory cause, and bicarbonate, it is directly related to the metabolic cause. So in this question, partial pressure of the pH is reduced. So when pH is reduced, what will the action of the partial pressure of carbon dioxide or amount of carbon dioxide? So in this condition, as this is inversely proportional, so partial pressure of carbon dioxide will be increase. So first event, we have to remember the first option pH. The second option, in case of respiratory cause, then partial pressure of carbon dioxide. But our body, it is very well designed, so we don't want more changes in pH. For this condition, for keeping the pH near normal, when the partial pressure of carbon dioxide increase, then bicarbonate also increase for compensation. So it is the third event. So first event, in case of respiratory acidosis, pH reduce. For this condition, partial pressure of carbon dioxide increase, as it is inversely proportional to the pH. When partial pressure of carbon dioxide increases, for compensation, bicarbonate level also increases. So this one equation is the basic equation to solve all the ABG report. So first of all, let's see the normal range of these three important parameters. So first of all, here we can see this is the pH. The normal range of pH is 7.35 to 7.45. So it is the first parameter which we will have to remember very carefully. pH 7.35 to 7.45. So when it is less than 7.435, it is acidosis. When it is more than 7.45, it is alkalosis. Then second important parameter is partial pressure of carbon dioxide, which is normally 4.5 to 6 kilopascal. So it also, we have to remember, it is 4.5 5 to 6 kilopascal. And third option is the standard bicarbonate level, which is the 22 to 28 millimole per liter. So these three important parameter, very important. And other options such as the partial pressure of carbon dioxide, partial pressure of oxygen, it is 11 to 14 kilopascal, anion gap 10 to 16, and chloride 98 to 107 millimole per liter. So it is the normal parameter to read for any ABG report. So again, let's see this equation, which is the pH is directly related to the bicarbonate and inversely related to partial pressure of carbon dioxide. And the carbon dioxide, it is responsible for respiratory part, and bicarbonate level, it is responsible for the metabolic part. So first, second and third event, first of all pH decrease, then partial pressure of carbon dioxide, then bicarbonate. So we have to go this sequence: first of all pH, then partial pressure of carbon dioxide, then bicarbonate level in case of respiratory acidosis and respiratory alkalosis also. So first of all, here we can see the options such as so these three options may be 7.19, 7.14 and 7.32. Here the answer is ready, but let's analyze other options such as 7.14. In this condition, first of all pH decrease. So when pH decrease, partial pressure of carbon dioxide increase. Here we can see the normal range of partial pressure of carbon dioxide up to 6. So partial pressure of carbon dioxide increase. But for compensation, bicarbonate also increase. Here we can see the bicarbonate, it should be increased, but here we can see it is low, because normal range of bicarbonate, it is 12 to, here we can see this is 22 to 28, and here it is the 14, which is low. So it is not true. So for this equation true, this bicarbonate should be normal or it should increase. And the fifth option, here we can see 7.32, which may be another option for respiratory acidosis. But first of all, here we can see the partial pressure of carbon dioxide. When pH increase, partial pressure of carbon dioxide should increase, and which should be more than 6 kilopascal, but here 3.8. So it is also not true. And in case of B, here we can see the pH decrease, and for this partial pressure of carbon dioxide should increase, and here we can see it is more than 6, which is increase. And bicarbonate, here we can see it is 23.8. It is 23.8, which is the normal range. So partial pressure of bicarbonate, if normal or increase. So as the partial pressure of bicarbonate level is normal and partial pressure of carbon dioxide increase, pH decrease. So in this condition, this equation is true. I think it is clear. If you have any type of confusion regarding ABG, you can comment here. Thank you all.